All right, so I'm Jodie, I'm with the Department of Aging, I'm a high cap coordinator. Diane Ball couldn't be here today, she had a planned vacation from a year ago. So she's sorry, she is the counselor. We do the same job, I just have a little bit more reporting duties than she does. Today we're gonna do Medicare 101, the basics of Medicare. Let's see if I can do this. July 1965, Lyndon Johnson put Social Security and Medicare signed into law, helping to try to take the burden off of older generation and ill people and low income families, the cost of some of the health insurance. And spread it equally among some of the affluent, more affluent, it's how it was supposed to work. In the simplest terms, Medicare is a health insurance meant to help people with certain eligibility requirements. You have to be over 65, have a qualifying disability, end-stage renal disease, or now Lou Gehrig's disease. Lou Gehrig's disease is an automatic now. If you have a disability, most common, everybody knows about SSI. Once you've been on SSI for 2 years, then you can qualify for Medicare. And it's a process, you get your A and B. It's always a process. And then you get that assistance. So if you receive your cash benefit before you're 65, some people take it when they're 62. We automatically enrolled into Medicare, A and B. About 3 months before your birthday, you start watching for that card. As you guys know, it's cardboard or paper cardboard type thing. And it doesn't look like it comes in like a card that would come like a credit card or something. A lot of people don't open that mail and they throw it away. So if you have children or family that are starting to age in, tell them to start opening everything because they don't want to accidentally throw away that card. It takes forever to get the replacements. The currently reside in the United States as a U.S. citizen or a permanent U.S. resident, that is changing. I was just at a conference this weekend, or this past week, I should say. The 5-year prior law is changing. It was that if you were here 5 years as an immigrant legally, continuously, you could then apply for Medicare. That has changed as of now. 2 months. 2, you have to have a green card, be from Haiti. One other country that slips my mind and I apologize. Or you lose your Medicare. So anybody with any other kind of visa will be losing their Medicare. And this is
how many people, right?
It's going to affect a lot of people. Hopefully they can get into the marketplace and get insurance that way. We're looking into things that can help them. So it didn't used to be that they could always get insurance that way. And then I'm not sure who signed it into law that they could. And then it changed so they could. And now it's changing back. So it's unfortunately these people that are into it now are caught in the middle. But we'll find ways. So if I've already mentioned, if you receive Social Security for 24 months, then you get Medicare. If you have end-stage renal disease, if you're going for the kidney transplant or a certain level of kidney disease and waiting for the kidney transplant, then you can get Medicare. Also, something I'm just learning, Certain cancer diagnoses can also, I don't know which ones can help you get Medicare. So the 4 parts of Medicare, A covers hospitalization only. And that is strictly inpatient. If you are admitted to observation, Part B covers that, not A. And you could be in observation for up to 72 hours. You can go from inpatient to observation, from observation to inpatient, back and forth. Depending on the doctor's findings for testing. However, Medicare has what's called an advanced beneficiary notice that you are supposed to sign anytime your status as an admitted patient has changed. Legally, they have to notify you. Every single change. You get a copy, the hospital keeps a copy, and it is supposed to be signed by you or a loved one. Unless you're completely incapacitated and there's no one there to sign for you. Okay, I pray that never happens for anybody, but the reason I expressly say this is because Medicare does not cover rehabilitation or a skilled nursing facility stay without a 3-day inpatient hospital visit. So if you've gone for observation and they try to transfer you to rehabilitation, whether it be in the hospital, because they have a rehab floor, or to the Pines or Allegheny, it's not going to be covered. That's going to come out of your pocket in the end. So I take care of people. I try to reiterate this as much as I can. Please know your status. As much as you are feeling so ill being there, tell your loved ones about this rule so that they can take care of your status. Okay.
Do you assure that you stay in the hospital for 3 days?
If you're going to rehab, there's a social worker, there's a discharge planner. Have them ask that question. Was there a 3-day inpatient stay? We have to know if Medicare is going to cover.
And if they're bouncing back and forth, how does that get calculated?
Ask them how, okay, they went from this day they were inpatient, this, or observation, this day they were inpatient, but then you moved them back to observation on this day. And now she's in, or he is inpatient again. Where are we on our 3 days inpatient? Because I know that the status has to be 3 days inpatient.
So it'd have to be continuous?
Continuous or not?
I don't know that answer because I've never been asked and I don't know.
Does the hospital get a higher reimbursement for observation than
No.
inpatient?
Not really. It's hard to explain. Observation, the insurance. I worked for the hospital. And I've seen them try fight with the insurance company to make a person inpatient. And the insurance company controls if you're inpatient or observation by what the doctor is putting in as
Code.
what's going on, what the findings have been. So observation means that the insurance company feels and the doctor has to perform more tests to see if it warrants an inpatient. Or if after a little bit of TLC, I guess, you can go home.
So it's to the insurance company's advantage to keep you in observation so they don't end up paying for nursing home care or rehab or hospital.
Well, not everybody goes to nursing home care or rehab,
Right.
but
This is the way to make sure though that they don't have to pay for it if it ends up being necessary.
there was a big lawsuit that was just settled for observation versus inpatient status, where people were sent to rehab, sent to skilled nursing facility. And Medicare won, and a whole bunch of people had to be reimbursed their fees for paying for their rehab paying for their skilled nursing facility because of the observation versus inpatient.
Okay.
So hopefully the hospitals are more involved now.
My high school friend who lives in Springs, California, was recently in the hospital. She broke something. It with some other things, and she's older. And they wanted to send her home. She lives alone. She couldn't do anything. She had to fight to be kept in that
She
hospital.
had to appeal the decision for discharge.
Yeah, and she finally did. She got help through Medicare. She called the
Good
office.
girl. Yeah, okay. Part B is drugs. It's easy to remember. And then part C is also known as the Advantage Plan. Puts all of them together. It doesn't always have your drugs in the C in the Advantage Plan, but quite often it does. Plus it has a little bit of vision, dental, and hearing. We just went over this. I don't jump ahead, I'm sorry. Okay, so Medicare Part D, the drug plan has 5 tiers. This past year that we're in now, if your drug plan had a deductible, tier 1 and 2, you weren't paying that deductible. Tier 3, 4, and 5, that's when your deductible, you had to pay that along with your copay and coinsurance. This coming year, January, most plans, it will be tier 1 that you will not have to pay your deductible, but tier 2 through 5, you will be paying.
So it depends what drugs are in those.
Where
tiers.
your drug falls on that level. If you've created what's called a Medicare.gov account, you can put your medications into it, and it's just yours. So your meds are the only thing in there. You can see your plan, and it tells you the costs for the year, an estimated cost per the plan's formulary, and if it's covered. And at your personal pharmacy, if it's a preferred pharmacy, if it's an in-network pharmacy, or if it's an out-of-network pharmacy, those are the 3 kinds of pharmacies. Preferred, you're getting the best cost. They're paying the most. In-network, you're getting a pretty decent coverage. Out-of-network, you're paying out of your pocket. You just might as well pull out your wallet. Okay, so like mail order is usually preferred. Because the company wants you to go through them. Walmart, 99.9% of time in network, half the time, 3/4 of the time preferred. They can go either way. Some of the mom and pop pharmacies can be out of network. Or if you go across state lines because you like some pharmacy just crossed the Pennsylvania line, that could be out of network. But if you use Medicare.gov, you can also put in your pharmacy, you can put in your providers, and that will show you who's in network and who's out of network. It's a nice little
That's
ditty.
good.
And we can help you create your Medicare.gov. You can do it yourself. You just go to Medicare.gov, as easy as that. All you need is an email, your Medicare card, because you need the number and effective dates. Simple. Then you create a username, a password, and you're on your way.
That's good.
Okay. Yeah, and everybody knows that the donut hole is gone. This past year, 2025, it was $2,000 for the most that you were gonna pay. Next year, 2026, they've estimated that it's going to be 2,100. It's not set in stone, but that's what we've been told. They're still capping the insulin costs at 35. So that's a blessing. The Medicare Savings Program. It's also known as MSP. So if you hear someone say MSP, you're gonna say, what? That's the Medicare Savings Program. It's an income eligible program for For a couple, it is, you can make up to $3,229 a month combined. And they will, Social Security will reimburse your $185 a month Part B premium. Each,
This is income only, right?
income only,
Yeah.
not your assets, not your resources. Single person, $2,355. Now, if your income is 2,003 for a couple, less than or equal to $2,371 a month, you will get what's called QMB, and you do not need to remember that. But what it equals to is you will get your 185 reimbursements. You'll get your co-pays, your co-insurances, and your deductibles paid for, and your health insurance premiums. The next level would be if you made that same amount, but then they would count your resources and assets. And for a couple would have to be, I want to say less than. Give me that in this, let me see, let me make sure. I'm pretty sure it's less than 43,000.
300
thousand,
a year.
yeah. Your resources and assets, don't, maybe it's right here. For a couple it's 43,781. And for an individual is 32,396. If you're at that or below, you can get Medicaid. We can help you fill out the forms, we can submit everything, we can do all the walking for you, and then you just wait for everything to come in the mail. It is a program that's Medicare offers, it is run through Medicaid, but it's a Medicare program. It is only offered to people 65 and under, or I'm sorry, over, sorry. And then there's a few people under 65 that will qualify. Right. I will let you know that I don't have the numbers yet for 2026 because we're not privy to them. The Part A and Part B deductible are going up. The Part A and the Part B premium are going up. They don't give us that, they let us be surprised. We'll all be surprised together. And let's see, but if you're on the Medicare savings program, you still get reimbursed. I know the COLA, there's supposed to be a COLA increase. They've thrown out numbers between 2.3% and 2.7%. It's not nailed in stone yet either. So again, we don't know.
And this is for 2026.
Yes, what will be coming in 2026.
You've been doing this for a while, right? Is this kind of a late time to know?
No. It's not. They keep those close to the vest. Until they've decided on what the COLA increase is gonna be. And that's probably another month and a half away. So, sorry. Okay. This is an example of what someone's insurance would look like. Roberto has health insurance plan that requires him to pay a premium of $100 a month. That's plus his 185 Part B premium. Because in order to keep your plan, you have to pay your Part B premium. He has a deductible of $300 a calendar year, a copay of $15 for his doctor, and a 5% co-insurance for generic drugs. Does everybody know what a co-insurance is? Co-insurance, not many people do. Co-insurance, say you had a bill for the doctor of $100. Your plan pays $80. That's what they're contracted to pay. There's $20 left. You're responsible for like this says 5% of that $20 that's left. So your co-insurance is the percentage that you're responsible for after the contract pays the contracted amount to whatever provider.
But you paid a copay
Yep.
also. Why isn't it just folded into your copay? It sounds like you're putting them together.
So the plans are writing them.
There's the messenger.
I cannot say why they can do copay and co-insurance. I just know this is how the plans are written. I'm living that dream too. My health plan does the same thing. All right, the types of providers, skilled nursing facility. It's a lower level of care than the hospital, but different than home health. They can take care of your wounds, they can give meds. Home health is they come into the home, they can do personal care, they can do occupational physical therapy, speech therapy. Hospice, long-term care agencies for the chronic and disabled, like residential care. And then durable medical equipment. Anybody has a CPAP machine, a walker, a cane. If you've never been on one and you're given a script for one, or your doctor says they're going to give you a script for one. If you're on an Advantage plan, please call your Advantage plan. Get it through your Advantage plan, because it's going to be less expensive than getting it through an area pharmacy. Because your plan has it set up that they have a contract with a durable medical equipment company, that you are only paying a co-insurance towards that. Where an outside of your plan, if you just walk into someone, you're paying a different percentage.
But what about like when he left the hospital? They just gave him crutches.
That's different. That's different. Cause they just charged his, like, to the hospital visit. Yeah. Or it's supposed to be. Okay, Roberta stayed overnight in the emergency room, was not admitted to the hospital. Was he inpatient or outpatient?
Outpatient.
Yeah, he was observation.
It's like,
Mm-hmm.
8 hours.
Well, this what I think what they're talking about is like 24 hours.
well, this was from 8 at night to 4 in the morning next day.
Oh my goodness. There's people that are spending the whole 72 hours in the ER now, because there's no available beds.
Yeah,
Okay,
more and more, it's gonna be closing.
I hope not. Personal care versus skilled care. Personal is non-medical, bathing, dressing, shopping, bathroom. Skilled care is anything that takes care of their condition or symptoms. Wound care, giving their medication, anything a licensed professional can do that me as a layperson couldn't do legally. Medicare generally doesn't cover personal care on its own. It has to have the professional care with it, the skilled care with it to be covered. So they need to have OT or PT to go with it. Your friend that broke their hip or whatever, when they went home, probably had PT in home, hopefully.
I don't know.
It could have got home care with it if that was the situation, as long as she was getting PT and OT with it. So my mom did, that's how I know. Preventative versus diagnostic, this is everybody's favorite. I gave everybody a card of preventative care. These are the things your plans are supposed to provide you for free. On the back is a giant list.
For free.
Okay, Yes. So all the ladies that still get mammograms, your mammogram is supposed to be free. When you go for an ultrasound, because they find something that looks suspicious, it then turns diagnostic. Because they have to do further testing. Then it turns into a copay. Prostate exam the same way. The colonoscopy, you go in, you get it done, you come out, they didn't find anything. That's preventative. A colonoscopy, you go in, they remove a polyp, they send it in for testing. It then becomes diagnostic, and you have the diagnostic outpatient fee. So anybody that's ever said, what am I getting billed for that? Now you know,
Sounds like
they're moving stuff around.
Oh, okay, it's not Sunday, okay.
That's not how.
We're not getting a storm.
Yeah.
So I just gave away the answer to this. Roberto received a colon cancer screening. During the screening, his doctor finds and removes a polyp, precancerous polyp.
That's diagnosed.
Enrollment periods. Initial enrollment is when you're first turning 65. You have 3 months before your birthday, the month of your birthday, and 3 months after. If you happen to miss that for some reason, January 1 to March 31 is a general enrollment period. That is when you need to enroll in your Medicare. You could then, while you're waiting, be accruing penalties for A, B, and D. So encourage your family not to miss their initial enrollment period. It's a 7-month window. It's pretty hard to miss.
Yeah,
It's a little bit more than half the year. Okay. Review your Medicare, your current healthcare coverage. Every year when open enrollment comes, even if you love your plan, it's never done you wrong. You should always review it to make sure when you get that letter in the mail that says, here's what the coverage is going to be next year. Review that. Maybe if you have a Medicare.gov account, look into some of the new plans and see if you still are in the best plan for you. Check it against your medication. Check it against the hospital copay. Things like that. See if you're still in the best plan. And make sure your doctors are networked. That's important. Okay. We just went through this and I did explain that, so if you're getting your, benefit before 62, you automatically enrolled. If after 2 years of being on Social Security disability, you automatically get your Medicare. And let's see, that's just one. And when you're just before your initial enrollment period, Medicare does not send you anything that says happy birthday, sign on. You're just supposed to know to do it. Would be nice if they did. All right, we went through this. So your Medicare, if you sign up the 3 months before your birthday and get everything active, your insurance, your Medicare A and B is supposed to become active the first day of your birth month. If you don't do it on time, it's going to be active the first day of the month after it's active. So I'm June. If I don't do it on time and it's finally everything's processed in June, it's going to be active July 1. So if I miss my open enrollment, my special enrollment period, and I wait to January, when I get it processed in January, it's going to be effective February 1. It's 1 month, the first day of the next month. Anita turned 65 in June. She signed up for Medicare in April. When is her coverage effective? June 1st. So because she got processed in time. So this is just an example of how that works. All open enrollment, everybody ready? Everybody getting the phone calls and the flyers and the spam and the emails? Aren't you thrilled?
So much
You don't
paper.
have to answer the phone.
In the red.
You can delete the emails. If you think you're being scammed, please call us. There is help. If it's too good to be true, call us.
It probably is, right?
Write down the phone number that they're calling you from. Okay, that's an important piece of information we need to pass on to SIM. Okay? Because they are also looking into things. And maybe just they can catch somebody. Okay. A special enrollment period is something someone has if, like, say, your contract is ending and you need to get into a new plan. You lose, some people have Medicaid, but then their income increases and they lose Medicaid. That's a special enrollment period so that they can get a regular plan, health insurance plan. Some people are have Medicare Part A only, don't have Medicare Part B because they're still working, they have their employee insurance. Once they are ready to retire, there's a special enrollment period for Part B so that they can get that Part B active. There's no waiting and there's no penalties.
Do you know if people that are dual eligible for Medicare and Medicaid, let's say they're over 65, will there also be a work requirement?
There's going to be a work exemption
So they'll be exempt.
for age and disability. Yes.
So 65 is the cutoff?
I don't know the age yet. We weren't given that. We were just told that there was going to be an exemption for age and disability. So we don't know if it's 60, 62, 65, 75. We just know that it's gonna be,
Yeah, right.
we just know it's gonna be age and disability. So unfortunately, we haven't been given the age yet. We just know that there is gonna be an age. I really hope it's 62. Mary has a Medicare Advantage plan. In January, she tells her SHIP counselor that she wants to switch to original Medicare, which an open enrollment period would allow Mary to switch from Medicare to original Medicare. I did neglect this. From January, we all know about open enrollment from October 15th to December 7th. That's original Medicare and Part D. But from January 1 to March 31, is there an Advantage plan open enrollment? That is just for Advantage plans. So you can switch from Advantage plan to an Advantage plan, or you can switch from Advantage plan to original and Part D.
Now, the original Medicare. Okay, which a lot of activists propose, that's. I thought that you would be able to take that with United Healthcare as a supplement, but I understand that's not true in New York.
Okay, so let me explain. There's original Medicare and Part D that you have to go with original Medicare. And original Medicare pays 80% of A and B coverage. Then there's a Medigap plan. And they're alphabetized A through N. That are offered by specific insurance companies. One of them is called United Healthcare. And that's called a Medigap or supplemental. And they pick up the other 20% of that Medicare covers. Anything covered by Medicare, the Medigap covered. So if you have that Medigap coverage, once you pay your Part B deductible, right now this year's $257. Then after you pay that $257 for the year, Medicare covers, then your Medigap covers. So the person you must have been talking to had United Healthcare.
No, we were looking into it and, right? We were advised because as a social justice person, I was going for traditional Medicare.
The reason a lot of people go for traditional Medicare, traditional Medicare has no network you have to stay within. Travel state to state to state. It
Right,
needs no referrals. It needs no prior authorization. It does not have any vision, dental, or hearing in it, however. It does cover cataract surgery. It does cover, in specific situations, dental procedures when deemed necessary for radiation. If you're a provider for the radiation states, they need this dental procedure done. Somehow there's some kind of coverage in there. I don't really know how it works. I just know that it's there. That's the only time those two things are covered. The Medigap picks up anything that Medicare covers. They cover it as well. There's 6 carriers in New York State. 6. There's a paper there.
which one?
I'll have, maybe it's still in my folder. There's either 6 or 8 carriers. Transamerica, United Healthcare, Humana, Bankers Life. And 2 other ones I'm forgetting. Aetna. And so they all offer this. And each letter plan has to offer the same service under that letter. So if Transamerica offers X, Y, and Z under letter G, United Healthcare has to offer X, Y, and Z under letter G. So it depends on what you want to pay for your coverage. But then you also have to carry Part D because it's not offered with original and the Medigap.
I have to go back, but it was that I was going to take United Healthcare as a supplement to original Medicare. But we were told that in this area or in this state, that isn't. And there was no reason that the person should not have spoken the truth. He's not getting any money from it.
Maybe it's what letter you were looking for that they didn't offer that letter anymore.
Well, I don't know.
Yeah, because I can show you when we're done. United Healthcare offers plans.
It's
the
the
Medigap.
largest, it's the biggest company.
And they offer in New York.
Well,
All right. So the late enrollment penalties for Part B is 10% for every year that you miss your Part B enrollment for life is added onto your Part B premium. So it would be 185 times 10% added on, then for life. Nobody wants that. Part D penalty is 1% per month for the benchmark plan. Benchmark this year is 7240, I believe. So 1% of 7240 times each month you were late, you didn't sign up, added onto your Part D premium for life.
That is so bizarre.
yes,
Part A is 1 year. For every 1 year that you didn't sign up, your premium is increased for 2 years. So that one's not for life. Okay.
we need universal health care.
But we do. We have.
Some of the Medicare notices are the ABN, the Advanced Beneficiary Notice, that's this one. It tells you when you're inpatient observation, when a service isn't going to be covered. And it allows you to decide if you're going to be financially responsible or if you're not gonna get the service done. That happens a lot with lab work and radiology. If the doctor didn't code your script the right way, that's when it's not gonna be covered. MSN It's not a bill, it just says, here's what you had done, and here's how much Medicare paid. It's sent every 3 months, and the EOB, the explanation of benefits, is sent every month, looks just like the MSN. Says this is not a bill, this is what you had done this month. You can make these documents electronic if you want, so that you can just see them in the virtual world. You can see them on Medicare.gov, you can see them through your email. If you prefer. Instead of always getting them in the paper form. Depends on what kind of person you are. If you like the hard copy, or if you're just okay perusing everything.
Do you know if an insurance company, like Independent Health or any of them, if they drop a certain coverage, like a dental coverage, do they have to inform all the people? They didn't inform us
When did they drop it?
last year, and all of a sudden, I mean.
Last year at the beginning of the year?
I don't remember when, but they dropped, what they did is they went to a particular Aspen. They went to a particular dental.
So they dropped a provider.
Yes, they dropped the provider.
They don't have to notify a provider.
Well, then the only way we know is when we end up.
When you set
getting-
up the appointment,
and
you should
end up
say,
getting the bill, but I mean, I think this insurance company should let you know if they drop.
they also try to put it back in your lap and say, anytime you make an appointment, you should say, are you in network? And I do always recommend to anybody that I help, always ask if you accept assignment for benefit for my insurance. That means they accept what your contract pays and no more. There's no more billing to you. Assignment for benefit.
They got screwed on that.
This is something I added this year, earning limits after retirement. If you're under full retirement age, 67, you can make 23,000 before Medicare starts, before Social Security starts taking $1 for every $3 you earn,
Annually, 23,000 for annually.
or every $2 you earn. If you're at full retirement age, 67 in 2020, at the beginning of 2025, then they take $1 for every $3, and the limit is $62,000. If you're under full retirement age before, I did that one. If you're beyond full, if you're 68, you can make whatever you want, they're not touching you. Someone told me at the last one, doesn't mean I go back to work. I said, you do whatever you want to do. Okay. And so that is that.
Well, that was very interesting, thank you.
The Medicare Savings Program. If you think you're close to that limit, even if you think you're just over, please get a hold of us. Please fill out one of the referrals. We would rather go through the intake and screen you and you be over than not do the intake, you be under and be missed for that assistance.
And isn't there some way in which you can put some of the money in another category?
It's called a pooled trust.
Full trust. They do that at Total Health,
Okay.
you know.
But we would rather field those calls all day long and help people than have someone miss.
That's very good.
Okay,
Is there a window for that or?
you can do it every month. And you can apply at any time is what I should say.
Okay.
For Medicare Savings Plan, you can apply anytime for Epic. Epic gives you a special enrollment period. Epic is a deductible program. They go by your income. They go by your income of the year before. They give you deductible. And once you meet that deductible, your medications go to a copay of between $3 and $20. if you. And you turn that card into the pharmacy, and the pharmacy tracks how much you're paying in. But because most people, if they have an Advantage plan, the Part D is built inside their Advantage plan. So that gives them one special enrollment period outside of open enrollment to change their Advantage plan if there's something going on with it that they don't like. It's a nice little ditty. And it's just quick little applications we can help you with.
Well, it's good to get the assistance because, you know, there's so much going on and it's very difficult. So the thing that happened with the dental care, we were getting a discount. And then all of a sudden we were not.
It's very important, and I know
And I
it's
said, you don't have to tell us that you dropped us, that they dropped that
carrier.
carrier
Yeah.
provider.
And I know it stinks, but it's very, very important to always check. To say, are you still in network?
Yeah, but the problem is you build up a relationship with your doctor or your dentist and it is,
And it's
you
gone.
don't wanna, and the
Yeah.
pharmacy and I like small family pharmacies. That helps them too.
Right, I go to Worthy's, so
And that's what we do too.
I'm not. One thing, we were told at our conference is. When we're opting people into their insurance this fall, open enrollment. Check their provider, take a picture. Proving that their provider is in network. When we enroll them. And then. So that if someone comes back to us and says. You said my provider was in network and now they're not. We had proof. For that client. That they were in network. And that gives them a special enrollment period. To change plans. So you're not stuck if that happens with your primary doctor. Or a specialist.
Definitely, we need to post the health too.
That's very helpful.
We absolutely do.
So there's a survey there.
Here it is.
I
Fill this out.
am not privy to see the survey.
Oh, we have to put it back into the,
You can just put it in one envelope, it's great.
no,
Yeah.
just put it in- yeah, the survey.
Oh, no,
Oh, no, there's nothing in here.
I've got tons of papers.
There's no, where's the survey?
On the page, on the board.
On the page with the fill-in circles,
There you
it's
go.
underneath your, it's underneath
Oh,
your,
there it is.
your preventative flyer.
Oh,
So you
okay.
can put your survey in here.